Alright, I'm Dr. McKay, and I'd like to welcome you to Core Health, especially for your plantar fasciitis. We got a pretty good track record of treating it, and I want to explain plantar fasciitis before I come in because there's a lot of questions I'm going to get anyhow. You know, a lot of times people think plantar fasciitis is just heel pain. Well, it's affecting the heel bone with a heel spur. It's quite honestly a lot more complicated than that. It involves a lot of the muscles in the lower extremity all the way up to the part of your stomach. So here you see a whole bunch of different muscles, and some of these muscles like the soleus, the plantaers, the gastroc, we have to check all these areas out to make sure that these muscles aren't affected. But quite honestly, in plantar fasciitis, they're affected an awful lot. I think that's where we separate ourselves from other practitioners. We find them and fix these areas. Now I want you to take a look here at the leg. There are a ton of little bones. So we need to analyze you from a biomechanical standpoint, and that's really crucial because we get the biomechanics down, it takes pressure off the muscles, which will then heal the fasciitis in many cases. Now, it's so much more complicated than just taking Advil, ice it, or shoot an injection of cortisone. There's a lot of different cutaneous nerves that are affected, as you can see here. So what we've done is we come up with a program where we employ a lot of different therapies. One, we address you on the biomechanical level, which is utmost important. Taking care of pronation, supination, and then restoring the muscle tissue by releasing the adhesions that form the fascia. Here's an X-ray where you see a heel spur. A lot of people have that spur, and it's not always related to plantar fasciitis. And what you see here is someone getting a little bit of cold laser. We use cold laser as part of the cornerstone of treating the soft tissue aspect of your fasciitis. Again, the fasciitis comes about when adhesions form in the muscle belly, and then after a while, sometimes they tear. If you tear, you're not going to be in here, but before that, you're here. Here's a technique called Graston, which is the name for Instrument-Assisted Soft Tissue Manipulation, IASTM, Graston. Great way for removing adhesions. And if we get these adhesions moving and cold laser stimulated and restore the biomechanics, you're going to have a lot better results. You're going to have an examination. We're going to look at the foot. We're also going to look at the calf. We're going to look at the anterior compartment of the legs, the quadriceps, the hamstrings, the IT bands. It takes a lot to figure it. But what you see here is this is a pretty interesting thing. Is say the foot pronates, you're going to have the knees buckling in, hips going off, shoulder going up. This is a common occurrence, but people are just not aware of what a simple foot problem can be. And if you don't restore those mechanics, and sometimes we have to put you in orthotics. But that foot flare, take a look at this image again because it's really important. I always tell people, take a look at your favorite pair of shoes, the ones you can't throw out, and look at the wear pattern on the back. That wear pattern is really indicative of if you have pronation, supination, foot flare, and these cause instability. Take a look from this one. Pronation is kind of where the ankle rolls in. You have the normal supinated where the ankle rolls out. Your basic directions. You could get some foot flare along with that. And this sometimes you do need to have an orthotic to stabilize. Look at the arch. It's a beautiful thing. It's a magnificent, strongest thing in architecture, the arch. When your arch goes in your foot, you're going to have problems. And that's where we come in from a biomechanical standpoint. Advil Aleve is not going to touch when you have a reduced arch. And as you get older, the arch does break down, and sometimes you do need an orthotic to prevent it from being. Hey, it's Dr. Brian McKay. I'd like to help you with your plantar fasciitis. What I'm going to ask you to do is hold on. There's this very special offer at the end. There's a pretty girl. She's going to tell you how to take advantage of it. When you come in, you get examined at a special low price. Just sit tight, and let's see if we can help you with your plantar fasciitis. Thank you very much.
Thanks for watching. I hope that you've learned some valuable information. I want to share with you a very special offer from Dr. McKay. It is really simple. All you need to do is click the special offer tab. You will go to our homepage and you will see me pop up with all of the details. I'm certain you're going to like what you hear. So click the special offer tab and look for me on the homepage. You'll be glad you did. Thanks.